All right. So I've got Dr. Ted Morgan here with me, Eric Vickery, and we're talking today about, well, really a continuation of our discussion last time, and taking the practice from perspective of should it be free of restrictive insurance, and how does that affect the vision? How does that affect the numbers? And transitioning today, this month, into talking about how does being insurance free and moving out of restrictive insurances to helping with, larger cases, getting patients healthier faster, doing, arch, side of mouth, full mouth cases to get patients healthy immediately. And also just some talking about different ways to make that simpler, like membership plans and how you talk to patients, how you treatment plan, how you present it. So Dr. Ted Morgan, thanks for joining me again.
Good to be here.
So I'm gonna come from the standpoint of a couple of things. One, I've never had more offices come to me in the last, I would say, 24 months since 2020. We came back and things got crazy busy, and inflation hit, and employees left, and then the people who stayed wanted more money. I've never had more offices come to me and say, it's time. I've got to figure out a way to remove myself from insurances that are not increasing their fees at all. And how do I do that? And so it has literally been the topic of the last 24 months for me. So, you coming from the perspective of having been there and done that, and working through, from a perspective of being insurance free, how do you see being on that side, insurance free, different than being in network with insurances when it comes to large case acceptance?
Well, when you say it that way, the picture that comes to mind is you just gave the third party the boot out of your operatory.
Yeah.
So as long as you've got insurance there that's restrictive and limiting the fee and how much you can do in a year, and then a patient that's conditioned to say, what'll my insurance
That's right.
cover? You're not free to treatment plan.
Mm-hmm.
You're really, you're being dictated to,
Mm-hmm.
and whether you are aware of it or not. And once you get rid of that, now your job becomes what it always should have been, which is just tell the patient the
Mm-hmm.
truth. You know, here's what we see. Here's
Mm-hmm.
what's going to happen if you let it keep going. Here's what's going to happen if you only do a little bit now, and you don't get this really taken care of. And here's what we can do. Uh, how does this sound? Or if
Mm-hmm.
there's more than one option, what are those? What are all the options you feel good about doing as the dentist? Don't limit options to something that's, well, I think they can afford this, or the fee's too big on what I really should do, so I'll cut it down to something more manageable in terms of cost.
Yeah.
um, as long as you're honest with them about what they really need, the full scope of it, and even beyond that, what are the things also that are elective that might benefit that patient?
Mm.
Sometimes that's much stronger motivation than the need things, the want things.
That's right. Moving into the
Yeah,
want side of things.
yeah, yeah,
Absolutely.
yeah. And
So,
the want things are things that insurance won't even touch. A lot of
yes.
them.
Yeah.
Yeah.
So you gave me a statistic before, and I'll let you share it here again, on the amount of dentistry that people without insurance do versus the amount of dentistry that people with insurance do. Do you remember that number you
Yeah.
shared with me? Share that
Well,
again in your way, because I don't want to mess it up.
okay. Well, we did way back when we were a couple of years into our membership plan. We had enough patients to make a meaningful sample. We looked at all of our new patients in three categories: those with insurance, those with no insurance, and those with no insurance but a membership plan.
Okay.
So the group in the middle with no insurance did about exactly the amount of dentistry that the group with insurance did,
Hmm.
as little as possible. You know, but the amazing thing was, and I expected going into this that we'd see a higher level of acceptance in the membership group, but it was amazing to me that, you know, one time we did it, you know, we took all the new patients for a 6-month period.
Okay.
We did it three different 6-month periods, and the first time we did it, it was, I can't remember the sequence it came in. I think it was 3.5 times.
Oh,
But
wow.
3.5 times more dentistry per patient average for the members than for the insured patients or the uninsured non-member patients. And then we did 2 more times. We got, you know, 4 times and 2.5 times or something
Yeah.
like that.
Okay.
So it averaged around 3 times as much.
Got
And
it. 3 times more.
and then,
That's
you
cool.
know, and if, let's say it's only double, would that be okay?
Yeah. Probably
Would that be
wouldn't, probably wouldn't be a bad thing.
Yeah.
So really what we're saying is when you're not restricted by insurance, and on top of that, people are in the membership plan, more dentistry is on the table for people to get healthier faster,
Yeah.
larger cases.
Yeah.
Is that fair?
Yeah, and it is. And part of what surprised me so much was the difference between members, uninsured members versus uninsured non-members.
Mm-hmm.
That, you know, the membership, it seems like it has an effect beyond what it really is. You know, when you look at it, say, well, you know, okay, they're prepaying their hygiene and they're getting a discount on services. Okay, you know, and the discounts amount to, you know, close to around 10%. They're not big. The effect that has on people, they feel like insiders. Their relationship with the office changes because the relationship used to be having money collected, you know, on the way out.
Yeah.
When they're in for hygiene. Now it's like, how are the kids? You know, did you see my grandkids lately?
Yeah.
See these. It really is a change when the numbers of members gets big enough. It's a change you feel in the office.
Yeah.
So,
Your relationship has changed. Your
yeah.
focus, your connection with them is different because they're not having to pay you as a non-insured patient every single time they come through, and they're going, the
Yeah.
fee increased, what, again? So I get that. It's amazing to me how many clients have membership plans now. I feel like that's a part of being insurance free. I feel like it only makes sense to have insulators that protect you, and that's one of them, whether
Yeah.
it be marketing dollars or at an office. They're up in, so one in Minneapolis area, one up in Michigan. Both we helped resign from a very big insurance plan, and the one dentist in Michigan, the write-off, we look at their tracker, was this is a very successful practice. Their write-off, and this one doctor, was $40,000 a month to this one big insurance company. That's 2 hygienists a month, their production. So here's the funny thing. They had one of our insulators, they had a hygienist retiring, leaving anyway. It was like perfect timing. So when that hygienist left, and you watch the tracker, it goes 40,000, 40,000, middle of the month we were out, 29,000, 5,000 write-off to 0 write-off, 0 write-off this month. It literally, you just watch it go down. Then you look over at the collection amount, right? It goes from, you know, 149,000 a month to 149,000 a month. Boom, 175, 200,000 a month. And you look at the production, because we're doing the write-off, the production literally stayed the same, and we got rid of a hygienist. We didn't get rid of her. She left, right?
Yeah.
So we cut back on payroll, right? We added, made one change, and yes, and patients do leave. They are leaving because it's a change, and they're leaving.
Yeah.
but
Yeah.
not from the standpoint of, oh my gosh. And in that time, we added an associate dentist.
Yeah.
It's
That
starting to happen.
the
That's
patient
just story
leaving.
one. Yeah.
Yeah. Patient leaving is the fear that prevents dentists from doing something. And you know, that's a great illustration, a great story, because it's exactly what I would expect. So
Yeah.
now they're actually seeing fewer patients and producing more.
They're collecting the same. They're collecting more. They're producing the same by
Yeah.
seeing fewer patients. And
Okay.
and I mean, the other office in
So they're getting paid for what they're doing.
They're getting paid for what they're doing.
Before they weren't.
That's right. And the other office is actually an endodontist, and they, you know, beforehand they were going, we need to hire another administrator, you know, to take care of this. And now since we've done it, he went to the admin like, oh no, we don't need another person, you know. And their increase in production after making the same change was $100,000 in 3 months. So when you look at last year versus this year, they're up $100,000 in collections in 3 months. I did not expect that. I got to be honest. So, you know, it just, we resigned from a smaller insurance and a very big insurance, and it just made the right sense. When all the stars align, it just makes sense. But here's the point. If you can offer a membership plan to people as you're out of this, it doesn't feel like, hey, here's the money, pay me the money now, right? You can say, you know what, you can enroll in our membership plan. Just enroll in our membership plan every month, and then you don't have to pay something when you come in to see us at all.
Yeah.
I mean, that insulator helps when you make this change.
Well, another piece of it, I think we might have mentioned it last time. If you go back to membership patients, accept more treatment 2 or 3 times more. And if you're worried about losing those insured patients you're taking a 40% cut on, you know, one member patient doing 2 or 3 times as much at the full fee minus the member discount, which is only like 10%. One of those patients replaces probably 6 of those insured patients.
That's amazing.
Yeah, it is.
Wow.
If you do the numbers,
you don't need as many patients.
No, you don't.
Yeah. Now,
well, and you're doing more dentistry per patient, so
that's the point.
Your patients are occupying your chair for a longer time. You're more productive. So fewer changeovers, less stress.
Those of you who know us and our relationship, they know that I call you master. It has nothing, it's just our history together. You are the master. And so hopefully that gets some giggles for some people, but you are the master. And the reason I call you the master is because of your verbal skills when it comes to what you just said there. You said you're doing more dentistry. Well, that's a big assumption for some people because not everybody is the master. I get that. And they want coaching. They want to know the verbal skills. So help out our clients with how do I do more dentistry? How do I get more case acceptance? That's such a loaded question, I know. But you know, if you think back to what maybe a switch that went off for you or things that you've seen in clients, you know, sometimes I'll look at these our case acceptance tracker, and their average case size they're presenting is in the 1,000 to 2,000 range, including new patients. And so I know that's not right. You know, talking to dentists, and it doesn't matter their age. You know, how many MODLs do you have on your procedure report? Oh yeah, I have 4 or more surface composites that I do. And so, you know, help them maybe from a clinical standpoint and from the master standpoint when it comes to verbal skills. What would you say is some things that they can do to not only, okay, stop thinking solely about insurance, open your mind to membership plans and how that helps, but also as you do that, you're going to be talking this way with patients when it comes to larger case presentation.
You know, if you go all the way right down to the foundation of it all, you know, I go back to something LD Pankey said. He said, you can't sell it if it's not on the shelf. And to have it on the shelf means you have to have the confidence that you can deliver. It's not about selling a big case. It's about having the confidence and the ability and the knowledge to do the big case first.
And that's foundational.
Yeah, otherwise you just get yourself into a heap of trouble.
Trouble, yeah.
So that really is, and so how do you get that? Well, you have to do it stepwise. You know, if you've all you've ever done is single restorations, composites or whatever, and now you know you're ambitious and you want to do arches or quadrants or whatever. Well, you need to build up and in steps. And I remember the first full arch case I did it on a guy that he was kind of a scam artist. And I did it for a barter thing, which never do that.
Yeah.
But what I got out of it was an experience of doing my first full arch case on somebody where something goes wrong. He doesn't have much foundation to complain, does he?
Yeah, what's he talking about?
Yeah. Yeah, he was supposed to do some work on my house, and he didn't finish it.
Yeah.
So
Yeah.
mostly it was a bad experience, but I always remember it as it was a very valuable thing clinically.
Yeah.
Because I learned that I could do this case.
Mm-hmm.
And so once you have that, then it's really a matter of like we were saying, just honestly letting the patient know what you see.
Yeah.
These are the issues. These are the things that I see. This is, what's going to happen if it isn't treated. And with permission,
Yep.
with permission, is it okay with you if I just, put it right out there? Here's what I would do if I were you, or if you were my mother, I'd want to do this.
Yeah.
And
you mentioned a word there. You said you can't sell it if you don't have it on the shelf. And what I often see a physical reaction from dentists, dental team members when I use the S word sell. It's literally like a 4-letter word.
Yeah.
So
still, huh?
Yeah, it's still that way. Yeah, still after all these years, right?
Yeah.
So let me ask you this. Let's assume I've got my clinical foundation. I've done my, CE clinically. I feel confident to do it, but yet I'm still not treatment planning it. I'm still holding back, or maybe I'm treatment planning it, but I'm phasing it.
Yeah.
And I'm just talking about this one phase here.
Yeah.
If you were to see that in a dentist, and what would your response be to that?
Well, why are you doing this? What's at the base of it? I would expect what's behind it, because I've experienced it myself, is the fear factor of rejection, that this patient's gonna think, that I just presented him with $25,000 treatment plan, and they're gonna go, who does he think he is? Or he's trying to rip me off. I could never heard of such a thing, blah, blah, blah. And, that would only happen if the patient weren't properly brought through the process, the diagnosis, the co-diagnosis, the permission, and at that point, when you get to the total of the treatment, if you've done all of that, they're not going to say, where'd this come from? They know where it came from.
They've been hearing all along.
Yeah.
Yeah.
And if it's gone, if you haven't jumped ahead of the patient, in other words, you're more eager to do the treatment than they are to have it done, they're going to want to find a way.
Yeah.
And all of a sudden, the patient that couldn't afford anything is gone, well, I could sell that lot that I have, or, something on that order. Aunt Tilly might lend me the money.
Aunt Tilly, yeah. Uncle Vern.
Yeah. Or Uncle Vern, yeah. Uncle Vern doesn't have much to lend these days.
Yeah, that brings us back, doesn't it? Using Uncle Vern. Yeah. So what happens with that sell word is it doesn't feel like you're selling them on something
No.
because you're not pressuring them. They're coming all along. So it makes me think of two things. One, before you can prescribe, you must first diagnose. I think everybody knows that saying, but I look at it from the patient perspective. Hey, before you try to sell me something, I got to co-diagnose with you.
Yeah.
Don't try to sell me something. And so the second thing of that is the story. We were just in Maui for our anniversary, and we stumbled across this, shop that was an artist, and they had an artist in there, and it was amazing art, like, waves. It was kind of 3D, like it was thick on the canvas. It was really, really cool. I'm walking through and I go to the next room and he's in there painting.
Mm.
I was like, wow, this is an amazing, I get to witness this guy painting. This is amazing. And he kind of like acknowledged me because I didn't want to interrupt. And I said, hey, I don't want to interrupt. I'm impressed. You do an amazing job. I just wanted to let you know, I'm sure you hear it all the time, but you do excellent work. And, I'm just trying to pay a compliment. Okay. Now you talked about don't sell before, right? And he goes, well, it's your lucky day. I can't make this up. He goes, well, it's your lucky day. I'm here. We can come up with a deal and I can ship it for you. Which one do you want? I go, all that to say, even artists have to sell, right? Every profession has selling. I joke, even the pastors sell. It's an information of I'm selling you information. You have to buy into what it is I'm talking about. And if our focus is on the condition, the diagnosis, and not so quick to, hey, it's your lucky day. Let me sell you 14 crowns here. We'll do much better. And then it doesn't feel like selling, right?
The patient won't buy a solution to a problem which they don't perceive to have.
I love it.
That's a Haleyism, and
yep.
It's so true.
Yep. So all my clients listening to this can say, oh, wow, Eric, he says this all the time. It's just like getting a second opinion, Ted. Thank you.
Yeah. Well, I've talked to people before about not being in a position where you have to sell the problem to sell the treatment. In other words, the patient doesn't perceive the problem. You've explained the problem and they still don't perceive it as a problem. Well, it's kind of a dead end.
You're not getting anywhere.
No, they're going to have to find out what the consequences are, probably. But you don't get don't expect 100% success, or you just end up putting pressure on people and getting a reputation for it.
Yeah. Very true. Very true. Yeah. I
You
wonder
need to go in willing to accept defeat
and be okay with that.
Yeah. You did your job. If you did your job, did a good job, and they didn't proceed, well, they might be back. But feel good about the job that you did do.
Yeah. I need to hear that, from you, just from a coach's standpoint, because not every dentist wants me to be their coach for something. It doesn't align sometimes. And sometimes you don't think about the 60 plus clients you're working with. You think about the one who left.
Oh yeah. Yeah. I'm at a post clinical career,
Yeah.
And I was telling somebody the other day, why is it I remember more failures than successes? They get under your skin. That's human nature.
If you care about what you do. Yeah. Just don't make it be something that makes you feel less about you in that failure. Understand that failures are part of the process. And it doesn't have to be failure. It could just be somebody who doesn't see it the way you see it. I don't even think that's failure. That's just difference of opinion, and that's okay.
Well, there's just a certain number of people. They're jerks.
20%, I think is what the rule is.
Maybe you've seen the Far Side cartoon. God creates the earth and he gets it all done. And then the last one, he's got this like pepper shaker, he's sprinkling down and it's labeled jerks.
Hey, let's pepper some around here, huh?
We'll just sprinkle a few in.
I hope it's okay. I say I manage your Facebook page, your social media, and you do a great job. And the team's involved with it. They do some posts within me, but typically I snapshot things and send them to you and Betsy, and we talk about how do we respond to this patient. And every now and then we'll get some response like, why does dentistry have to be so expensive? And
Yeah.
they go that route, right?
Yeah.
And
Yeah.
and yet you have all these people who are happy with everything we're doing, and then you got these little pepper shaker people who are gonna feel
Yeah.
comfortable on social media saying some things. And so I think to sum it up, just to give an outline here is, as you're considering your numbers and looking at your insulators and saying, okay, should I be in network with this insurance? Does it make sense from my business standpoint to do this? I would say a vast majority of the time it does not make sense. Very rarely will I say, oh, go ahead and stay in. Um, but but if you're going to do that, your insulators have to be in place. And one of those is, I think, a no-brainer is a membership plan, which we talked about. And I think the other is having confidence in yourself to treatment plan in a healthy way. And what, like you said, what would you do if it was your mother or a family member sitting in Whittiam? Would I do it on me?
Yeah.
What would this treatment plan look like? And then have good verbal skills systems that help you speak in a way that doesn't sound like you're selling, knowing that you have
Yeah.
to sell. Is
Yeah,
that
I think
fair?
the verbal skills were the last thing to fall into place for me.
Mhm.
I spent a lot of time early on collecting clinical skill and thinking that was the answer, and then I
Mhm.
realized that no, I'm not. I don't have the verbal skills, and I remember getting to a point where I felt like, however this conversation goes, I'll know what to do because I've learned these various skills.
Mm.
Whereas before it was like, well, what if they say this?
Yeah.
I don't. What am I going to do? What do I? And once you feel like you know how to respond and deal with a situation, whatever comes up, comfortably, that makes a huge difference.
Okay, so you're alluding to something which I spend all my day talking about with clients. How long did it take for you to go from old version of TED to master version of TED when it came to verbal skills?
You know, if I answer that question, it seems to say something about me I don't believe myself. I felt, uh, the turning point in what I just said about reaching a place where I felt like I could handle a situation was when I really, it was the objection formula.
Mm,
Believe it or not, it was
mm,
because that was the fearful point, where the patient says, no, I'm not going to do that. I don't think that would work. Or,
mhm,
Uncle
mhm.
Harry had it done and he died, or, whatever it is. Um, once I felt like I knew what to do, knew how to handle an objection, and over time realized that it's much simpler than we made it, in reality.
Yeah,
Um, that's when I started feeling like, well, it's fun to walk into these situations. Let's see what happens because, like it's like a tennis match. I can return your backhand.
yeah, yeah,
I know what to do,
yeah,
and the bottom line is you have an appreciative patient at the end who feels understood,
yeah,
however it came out. And if it came out that, well, I really want to do it, but bottom line is I just can't afford it or whatever,
yeah,
hate to say it,
yeah,
well, then we can all walk away feeling good
yeah.
still.
That life condition that gets in the way. So you didn't just go to a seminar one day and came back and magically you had the master of verbal skills that you had. It took it took some practice and some work, right?
Yeah, the verbal skills for sure. The confidence was much more sudden, I
Yeah.
think.
Yeah. The
That
realization
Yeah,
that I should be confident in this, boom. And
yeah,
once you do that, now it's just being comfortable with those verbal skills
yeah,
and
yeah,
repeating. And your training was on repeat. You guys were always training these things nonstop, right?
yeah. We would go over it a lot. So
Yeah.
yeah, I think it's the self-confidence you need clinically and then verbally,
Yeah.
and both of them together will pretty much guarantee,
Yeah.
that you'll be seeing more acceptance of bigger cases. And
I
I
love
and I
hearing that.
will say again, but going back to membership, that fee that lower fee that you give a member when you present a big case, we typically will present the whole normal published regular fee, and then, you know, and then say, some point after that, would you like to hear how you can save some money on that? You know, assuming this is a new patient with, you know, in practice that hasn't gotten the membership yet. If they have, we may still do the same thing and say, but since you're a member, you know, you're going to save this much. And we always talk about how the dollar amount they save, not how would you like to save, you know, 10% or whatever. No, how would you like to save $2,800?
Yeah, because then it sounds like a sale, like a sale tactic. Yeah.
Yeah,
Yeah. Yeah. Here's what you'd save as a membership plan, this dollar amount. Membership member. Yeah.
Yeah.
Member of their
And
membership.
how I just said it is not how I'd want to say it. I wouldn't want to say, how would you like to save? No,
Yeah.
that sounds like the furniture store.
Yeah. Yeah. It's your lucky day.
Yeah. It's your lucky day. Don't miss it.
All right. Well, we'll stop here until next month when we do this again. And so thank you, Dr. Ted Morgan. And as a reminder, you know, you're available to dentists who want to talk about this sort of thing, right?
Sure. Yeah.
And we've made you available. And so if you want to bring Ted on as your coach, he's here for you on the coaching team. So thank you, Ted, for being just a willing mentor at this stage of your career and willing to pour back into others. I really appreciate it.
I enjoyed it. Thank you.
All right. Thanks, Ted. All right.
Yeah.